So can I just see, how many of you all went to the PCDC Introduction to Care Coordination training? Good, so most folks. I'm gonna be building on some pieces of that here. So can folks just share, from those few days of training, what do you remember and what did you sort of take with you that's been useful?
The whole health literacy
Mm-hmm.
unit is something I ran with once I left there and have implemented elsewhere. So just fantastic health literacy introduction and training.
Great, and how have you been using it?
Teaching at locations. I'm a facilitator, so I don't work directly with clients,
Mm-hmm.
but teaching at a team of caregivers, nurses, and whatnot at a primary care practice.
Great.
So brushing up on their skills.
So I think we're just going to ask people, even loud voice people, to use the mic just for the sake of recording, if that's okay.
Do you want me to repeat?
No, you're okay. That's all good. Thank you.
Thank you.
Other folks, what have you held on to from that training? Is it gone?
Just so you know, I was pretty excited about the motivational interviewing. I was pretty excited about the motivational interviewing piece, and we do use that in the practice that I work in, but I could definitely tell that I needed to brush up on my skills. It's something that it's just, you think it's innate, and you might talk about your, profession, you've got your degree, it's just not an innate process, and it takes practice. And I think that's what I was realizing is one thing.
Yes, I can put, okay, I guess you have to put it right up to your mouth, otherwise you can't hear anything. But I think one of the things that I took back from the motivational interviewing is really wanting to kind of implement some of that in our staff meetings.
Yes.
And just doing some role playing.
Yeah.
Because it's not as easy, we like to think it's easy.
It's
the
not as
way
easy
we
as
work.
it sounds.
It's really just not as easy as it sounds. But there are a lot of other things to the resilience piece, but mostly I'm kind of really wanting to put some more focus and practice in.
That's great. Anybody else? So this is definitely one of the places that I want to have us continue to practice in all of our practices here. Okay. So yeah, I just want to do a quick recap on motivational interviewing, because usually when I do training, that's the first piece that we spend time on, because I think it is one of the most practical ways to do client-centered care. And you all have heard the spiels, I assume, if you've been in the training, but how do people currently use motivational interviewing? What are you doing with it now in your work? Yeah, and folks, if you can say your names before you talk, that would be great.
Hi, I'm Lindsay. I'm from Springfield. And I usually use motivational interviewing in work to progress people along, like, what is it called, like pre-contemplative,
Stages of change.
stages of change. That's generally kind of when I use it, but I think a lot of it is kind of innate where you find you're doing it, all of a sudden you're like, wait a minute, I know what this is.
Yeah, so in some ways it sort of puts a name on maybe what people sort of intuitively were doing already. But thinking about, when you're working with clients around behavior change, kind of where are they in those stages? Good. Other folks, how are you using motivational interviewing?
I'm Catherine. I'm in Burlington at Cathedral Square. I often use it to help the residents that I'm working with kind of get to a decision and an action moving forward, to help them come up with the idea and plan that's going to work for them versus me or another SMASH coordinator or staff telling them this is what you should do, and then that never works. So just helping them get to it on their own so that they're motivated and excited about it.
That's great. Thank you. Anybody else thoughts about motivational interviewing? Thank you. No, I do too. I'm like, I can't believe they're making me use a mic.
For me, I do a lot of diabetic training, and so by the time they come to me, they have often been down this road many times before, and the doctor will say, "I've already done this, they've been through that before, just need to get them to really do it now." And so, so they often come in just like, I know why I'm here, and they feel like it's a punishment that they're there. So I use motivational interviewing to try to really get to know them, maybe try something different that hasn't worked in the past for them, identify what those things are, and their experience with them, their personal experience with them.
This is good. So to kind of be able to shift those meetings from being punitive to actually being collaborative and really tune to who the person is that you're working with. Yay.
Hi there, I'm Laura. In the Learning Collaborative down in the Brattleboro area, in conjunction with the Camden cards, which have different topics, social determinants of health. The teams were also trained in motivational interviewing, so they use it to really elicit from patients who really need care coordination what's going to motivate them for the change, rather than being dictated to, and similar to what you're describing there. So very parallel dynamics to break the old dynamic and try something.
Great.
Hi, I'm Melissa. I work with staff who do direct service.
Mhm.
Oftentimes they are great at using motivational interviewing to set realistic goals for participants, but not so great at doing it for themselves. So they have extremely lofty goals. They want to do like amazing, wonderful work, but I use it to help them set more realistic, reasonable goals to get to that.
Got it. So thinking about realistic goal setting, not only with clients, but also with staff. Awesome. Thank you. So I'm a huge fan of motivational interviewing. I think it's a really nice way to build trust, to figure out what people actually care about, because if you don't know that, working with them can be very, very challenging. And realistic goal setting. Can we just do a quick review of OARS? Do people know what OARS stands for? Because I'm going to ask you to do it, so if you don't know, this would be, yeah, let's just review it quickly. So what's the O in OARS? You can shout it out. Yeah, open-ended questions. And why do we, I'm going to take another piece of paper here. Why do we use open questions? That was an open question right there.
Progress the conversation.
Yeah. Yeah, so if you ask people a question that has a yes or no answer, usually you get a little something something and then it kind of dies. So the open questions keep the conversation going. Anything else about open questions?
You don't want to put them on a path, direction, your direction.
Yeah. So, I notice when people ask me closed questions, it's like, where were you on the night of April 13th? And you're like, that's not actually what I want to talk about, that's what you want to talk about. So an open question kind of puts the person more in control of the conversation. This is good. And what's the A? In this one, I don't know if you guys taught it differently, is affirmations. So what's an affirmation? Anybody know? It's Vermont, you should know. You're going to have to correct my Massachusetts stereotypical thinking going on here. Anybody? It's just an appreciation of something that somebody is doing well. So, you have a client that comes on time to an appointment, you affirm that. You have a colleague that totally stepped up and handled something for you while you're on vacation, you affirm that. You have a client who has missed 5 doctor's appointments and they show up and they go to their appointment, you affirm that. So it's just recognizing what's going well, even if it's something that seems really small. All right, I'm going to review the other two just for the sake of time. So in the model that I know, the R is for reflections. Anybody know what's a reflection? How do you use it? would say that fits more in affirmations. For this, reflections is just, yeah, go ahead, in the purplish sweater.
It's sort of summarizing a little bit of what they said, but also taking like a risk. Summarizing what the person said, but also taking just a risk, even if it's wrong, at saying, oh yeah, so you're saying this, and then they can either like say, no, that's not at all what I mean, or they can say, yeah.
That's right. So kind of saying back to a person what they've said and kind of giving your best understanding of what they were actually trying to tell you. So what's the meaning? Are you happy? Are you sad? Are you annoyed? Do you want to follow up? Are you confused? And if you get it wrong, the person will correct you. So reflecting is a really nice way to make sure that you and the person you're talking to are on the same page. Good. And the last one is a summary. And I think people who work in medical fields do these very well. So, you know, you do your notes, you know what goes into those, but the idea is we may cover a lot of ground in a conversation with a client, and so, you know, if we've been talking about housing and now it's time to talk about diabetes management, we're going to summarize the housing piece before we move on. And then at the end of the meeting, we're going to summarize, you know, what are you going to do? What am I going to do? What did we figure out in this time together so that we sort of stay on the same page and clear about what's been going on. So summaries, I think, are about, again, about really ensuring collaboration, and also I'm amazed how often I have a conversation with someone and what they take away and what I take away, never the two shall meet. So a summary is a nice way to be like, oh, I thought this is what we were going to do. And they're like, oh, no, I thought that's what we agreed to. And then you prevent the confusion before it makes problems. All good. Comments or questions about this? So I'm going to ask you, as we do our practices throughout the training, to be thinking about doing the active listening and using these elements to the best of your understanding. And if you have questions about that, we can talk more in small groups or individually as we go. Okay? So I want to give you a little bit of time to do just some reflecting on where you're at with your work now, in terms of what's going well, where you feel stuck, where you feel inspired, and then have a chance to share with another person. So hopefully everybody picked up the little paper called Work Self-Assessment that was on the table there in the back. So I want to give you just a little bit of time to write and reflect on your own. And then you're going to pair up with someone else at your table and discuss. The thing I want to say is write anything you want on this paper. It's yours. And then for the sharing, you share as much or as little as you feel comfortable with the person you're talking to. So like, you know, if you're super burned out in some area or you have a boss that you want to kill, it's okay to put that on the paper, and you don't have to say too much about that unless you feel comfortable at your table, okay? And in terms of videoing, I think if there's a pair that would like to be videoed, that would be fine, and if not, we will not record this piece, okay? So I'll give you maybe 6 or 7 minutes to just do some writing. Some of the questions may not speak to you, and if they don't, just skip them and spend the time on the things that kind of draw your attention more. So you all can say thank you to your partners, and let's gather as a large group. So I would love to hear from folks if you heard commonalities, aha moments, any interesting differences in sort of where you're at and how you're feeling about your work.
So,
I'm patient, so.
So Melissa and I, my name is Amy, so does this even work?
Yeah.
So Melissa and I do the same function within our program of SASH.
Okay.
And so we support staff, and it's interesting that we have very different territories and different projects that we work on, but our sort of our joys and our frustrations are the same in the work that we do, which was nice to know.
Got it. And anything you want to share about what they are?
I think that we both have done a lot of direct service, and so the way that we do our work now is we approach the staff that we support in much the same way, and so that still feels like we miss direct service, but
Yes.
feel like we're still giving back or trying to be supportive in that way, which is great.
Got it. So sort of a common transition from direct service to supporting staff in a sort of staff-centered way.
Right, right.
Awesome. Good.
Hi, my name is Sibel. Is it working? No. So just one of the things I wanted to mention is that we're all engaged in this really intense work, and it can be very hard with the clients and the patients that we work with, as we've talked about social determinants of health, lots of psychosocial stressors, comorbidities, poverty, and we talked about, you know, when you're actually really engaging with, you need to feel as supported as possible by leadership, by your supervisors. You need to have people to be able to go to really talk with, strategize. You know, one of us here has patient loads that are just unbelievable case loads, and so you really do, you need to be supported. And I'm just hoping, like everywhere in all of our agencies, we have somebody that you can go to actually feel supported and kind of problem solve and get that any instruction you need.
Or not.
Or not.
Yeah, so that theme just sort of acknowledging the challenges of the work and wanting that support to be in place to make the work sustainable. Good. Other folks, commonalities, aha moments, any interesting differences across sites and roles?
Hi, Alyssa. We didn't talk about this at depth, but it came up sort of how easy it can be or could be to just move from crisis to crisis in this work, and sort of the importance of, again, like you said, having an organization behind you where, or having systems in place where you can, in this type of role, take a more planful approach, even though that other stuff will happen. But that's something we talked a little bit about.
So thinking about how not to sort of get recruited into living from crisis to crisis. Yeah. Well, and I feel like if it's not clients, then it's like reporting or administrative or agency-based stuff, and it's like, you don't want to be running all the time if you can help it. Thank you. Anybody else? So I think it's important, just knowing the pace of the work, to sort of take some time and step back and kind of look at where we're at. You know, with the idea of being planful and being intentional, sort of about how we show up to the work, to our teams, to our clients. So just wanted to give us a little bit of space to do that today. Were there any things that, you know, as you were reflecting on what would support you in doing your work better, or what kind of your learning needs are? Was there anything that jumped out, you know, for you or in your conversation with your people?
Hi, I'm Gina from Northeastern Vermont Regional Hospital. I'm with Community Connections. And I think in our discussion, I found that I'm very fortunate that with the work that I do, that I work with people that have the same love and compassion that I do.
Mm-hmm.
And one of the things that I felt would be important here is learning from other people's experiences. We don't work in crisis, so we teach people how not to work in crisis.
Mm-hmm.
But you can get caught up in it when they walk in the door, and it's crazy, and it's counting the time, bringing yourself down, and then working with them to get out of the crisis, but also maybe 24 hours of thinking, and people are really pretty resourceful on their own.
Mm-hmm.
But I think just learning from people here is a great experience for me.
Good. Good, good. Yeah, so we've tried to set it up so there's a lot of time for you all to talk with each other, because I think that's usually where the best ideas come from, is like, you know, someone else has tried something and we're like, oh, this really worked, and you can sort of take it and run with it. Thank you. Anybody else? Hopes, learning needs, things that would support your work that you got any clarity about in your reflecting or your conversation?
Oh, resources.
Yeah.
Lack of resources. I think we all have that, things that we need for our patients and our clients that we really struggle to help them get because there are no resources.
Mm-hmm. I think this is one of the things I've noticed is just big difference between urban and rural work is, you know, in the city, it's not that, we have what you need, it's just a question of can you jump through the hoops to get it, and did it run out? And for you all here, I'm amazed at what folks do with way less to work with. So I think too, if you have good resources to be able to share them with each other, is great. Thank you. So I realized too, I was doing a little chatting with Maya about my work, and I realized I didn't introduce myself. Someone was going to do a spiel for me, and I was like, don't do a spiel, I don't do a spiel, but I wanted to just tell you, like, so I am a mental health clinician. I've worked mostly as a clinical supervisor for community health programs for most of the last 10 years, but I started in homelessness work and have done HIV work for close to 20 years. That's crazy. So in Boston, in New York City, and for the last close to 5 years, I've been doing a lot of training. So I do group clinical supervision, individual supervision for a bunch of programs, HIV programs, chronic disease management program, and prison reentry program in Boston, and then work with programs nationally, mostly HIV programs, but a lot of my work is about how do you support staff. So a lot of work with supervisors around team building and listening and collaboration and accountability stuff. A lot of work around how do you work with complex clients in a way that is collaborative and effective and doesn't make you crazy. And because I've been doing this work a long time, and people are like, are you not burned out yet? And I'm like, I'm actually really not. I have my moments, and then it's like, okay, how do you step away from the thing that's not working and sort of shift it? But I think, yeah, so I've worked with a lot of different kinds of clients, a lot of different kinds of staff, and hopefully can draw on some of those experiences in terms of working with all of you. So that's the short spiel, and if you have more questions, I can tell you more at some point.